We're very happy to be celebrating 30 years of service to Omaha. We began 1983 providing services to this particular community as a result of a small group of people identifying that there was a need that wasn't being met. And through this small seed that was planted to take care of a small group of vulnerable people, we have grown into a very strong healthcare delivery system that people depend on for their primary health care, as well as their other needs that simply help them to have a better quality of life. And we know that if one's health is great, or if one has good health, that it translates into being able to get an education, to be able to work, to be productive, to be able to raise families and have a productive society that can contribute to the mainstream of life. I'm not sure that the people who planted the seed and started Charles Drew Health Center actually realized how large it would have grown to and how many people that it would have served, and how much the quality of life has improved for the people in North Omaha. We believe that we have contributed a great deal of wealth to this community by making sure that this community is healthy.
In the early 1980s, a group of determined community activists came together to address the issue of access to health care for families living in the east-northeast sector of Douglas County, known as North Omaha. They were representatives of the local community-based organizations, advocates, civil rights leaders, graduate students, and concerned citizens. Like so many socially conscious men and women, these pioneers made a commitment to themselves and the citizens of North Omaha to create a paradigm shift for how Omaha's urban community addresses health disparities. Early in our city's history, North Omaha was the place to be. It was one of the most affluent communities with upscale homes in neighborhoods like Lincoln Boulevard or Florence Boulevard. But the race riots of the 1960s resulted in white flight, which left many once thriving businesses vacated by shop and business owners who chose to relocate further west. In the 70s, the community also realized a devastating impact from the freeway construction. This physical, symbolic barrier divided and damaged an area already reeling from racial tension. Grocery stores, pharmacies, retail shops, physicians, and healthcare services were among the many establishments that began to disappear. The once robust commerce, entertainment, employment, and nuclear families that populated North Omaha were deeply affected by the social, economic, and cultural changes of those years. The Community Health Center concept became a much sought-after answer to the lack of quality, affordable medical service in the North Omaha area.
When I am ill, I can call and make an appointment and get in right away to see the doctor, and then just the quality of service that I'm given here makes me very comfortable with leaving my health in Drew Clinic's hands.
In 1983, the coalition of community activists celebrated the news that Omaha, Nebraska had been awarded federal funding to start a community health center that would be located in the heart of North Omaha. Charles Drew Health Center opened its doors offering women, infants, and children support services through the state of Nebraska's WIC program. Even before the healthcare services were available, Charles Drew Health Center demonstrated strong commitment to families and the most vulnerable in our community, our babies. The first permanent home for Charles Drew Health Center was a converted laundromat located at 2201 North 30th Street. Former Senator J. Robert Carey and Congressman Peter Hoagland were instrumental in securing federal funding to renovate the laundromat and convert it into a viable clinic. By the early 90s, it became clear that the health center had outgrown the small clinic and needed to expand to temporarily address the needs for more space. A 4-room trailer was leased to house a small lab, physicians, and provider space.
I came here when I was to visit my niece, and I felt very sick, and when she was so worried, all of us were so worried. We didn't know what to do. She said she She didn't know how to go about it without insurance. She had no money. She's a student at the Creighton University. So when she met this friend of hers, Violet, who works at the Human Resource Center, they just conversed and she talked to her about me. Oh, and she was crying. She was actually crying. So Violet said, oh, don't you worry, I'll take you over to Charles Drew. They are so good there. I'll take you over to Charles Drew. I'm sure your aunt's problem will be solved. So without hesitating, I would say it's really been wonderful. I never expected it. You know, when I fell ill, I just thought it was going to be the end of me because I couldn't really walk. So they did everything possible.
For the period 1993 to 2003, Charles Drew Health Center grew from serving approximately 3,500 patients per year to serving 8,000 patients per year. The clinic adopted the slogan, "Your Partner in Healthcare." The slogan spoke clearly to the intent of the health center and its governing board and executives. Under the direction of Executive Director Robert L. Patterson and Board Chair Reverend Nigel L. McPherson, CDHC completed a $1.6 million construction project and relocated the health center into a new 13,500 square foot facility at 2915 Grant Street. Charles Drew Health Center expanded its health care service delivery system to include a large initiative to increase HIV/AIDS testing and counseling in North Omaha. Today, the health center facilitates more than 34,000 patient visits per year. The clinic has grown from operating at 4 locations to 12 locations. Interpreter needs have moved from limited Spanish interpretation to interpreters that speak more than 15 different languages.
I would want my family to come here. I think that because they're professional and because they know what they're doing and they explain everything before they do it, especially with children, I think that they would really make them feel comfortable. So that's why I would suggest them and refer them to Charles Drew.
Since 2003, Charles Drew Health Center has experienced tremendous growth and development. During this time, the health center's service delivery system expanded to include the addition of Nebraska's only infant mortality reduction initiative, Omaha Healthy Start. Through Omaha Healthy Start, a responsible father involvement initiative, Fathers for a Lifetime, was created. In 2007, under the direction of Chief Executive Officer Richard L. Brown, Ph.D., and Board Chairperson Elizabeth Campbell, CDHC completed a $4 million capital campaign that added an additional 13,500 square feet to the existing structure. The expansion doubled the number of exam rooms and created spaces for the health center's WIC and Healthy Start programs, and expanded the pharmacy and laboratory area. The expansion also included a full kitchen for cooking and nutrition classes. Other expansions include the addition of interpreter services, expanded healthcare services, creation of CDHC's patient and staff wellness program, expanded advocacy and enrollment support for Medicaid and Kids Connection, nutrition services, the addition of a disabilities assistant program, and increased STD testing, treatment, and partner notification. Charles Drew Health Center was among the local healthcare providers engaged in the development and implementation of the Building Healthy Future school-based health centers. Charles Drew opened 4 school-based health centers at Belvedere Elementary School, Kellum Elementary School, King Science and Technology Magnet Middle School, and Northwest High School. This year, Charles Drew Health Center opened 4 Omaha Housing Authority public housing health clinics at Crown, Evan, Florence, and Jackson Towers.
The first time I came into Charles Drew Health Center, I was pregnant with my first daughter. It was about 1996. And I knew that she was a girl, and I wanted to have a most complete prenatal care. I had 2 sons before, and I was young. I never really went to the doctor when I was pregnant with them. But I wanted to make sure that everything was right with her. And so I came to Charles Drew for prenatal care with her.
Healthcare in America, Nebraska, and in Omaha is changing. The delivery of quality, affordable healthcare is evolving into a relationship that demands cooperation and respect between patients and his or her primary care physician. As we prepare our patients and community to navigate the many changes associated with the Patient Protection and Affordable Care Act, Our certified patient-centered medical home status demands that we work in partnership with the best specialty care, technology, and pharmaceutical treatment available. Our board-certified physicians and mid-level practitioners, supported by our Joint Commission status, assures that Charles Drew Health Center's safety and quality of patient care remains at the highest standard. We never lose sight that our employees, family members, and our community members are all patients. In 2013 and beyond, Charles Drew Health Center remains committed to providing quality, comprehensive health care in a manner that acknowledges the dignity of our patients, the strength and uniqueness of family, and the important role that the community plays in assuring that we are growing a healthy community.
While we've had a rich history of success and progress, there are still challenges. And as we go forward, we're going to continue to need the support of the community to help us navigate, as well as help the population to navigate the healthcare delivery system. As a result of the partnerships that we've had over the years, we believe that we're stronger than ever to be able to provide quality care, and we're looking forward to continuing to have an impact on the population for generations to come.